Hey guys, Dr. Aaron Andrews here, chiropractic neurologist at PC Wellness Centers. Thanks for taking the time out to watch this video. Hope you guys are having a great afternoon. I'm going to talk a little bit about TMJ today, about TMJ dysfunction. Stay tuned to the end of this short video. I'm going to give you guys some home tips and home care on how to maybe relieve some of your pain and your clicking and some issues that are going on with your TMJ. So first of all, an explanation. Every time a patient comes in and they complain of jaw pain and clicking and hurting and not being able to open up their mouth, they say, "I have TMJ, doc." And I always come back with a little joke. Of course you do. Everybody has TMJ. So TMJ stands for TemporoMandibural Joint, and I'm going to show you guys a picture in a second. So actually what they should be saying is, "I have TMJ pain," or "I have TMJ problems," not just TMJ. Kind of silly, but it always irks me when people say that. So TMJ stands for TemporoMandibular Joint, okay? And that is the joint that is the top of your mandible and then your temporal bone come together right in front of your ear here, okay? And it's the most common used joint in your entire body. Obviously, you use it all day long to talk and eat. So that's the joint, okay? And then in this little space right here is a little bitty disc, okay? And then there's a little bitty disc there, and then going forward and going backwards are two little ligaments, all right? And that disc doesn't have any blood supply and it doesn't have any nerve supply, so it doesn't feel anything. And whenever you guys open your mouth real wide to do anything, that disc translates forward, okay? And some sort of trauma or overuse or sleeping wrong or something can cause that disc to get locked in that forward translation spot. And then whenever you bite down, you're biting on the ligament behind it. You guys understand that? And that ligament obviously has nerve supply, so then that's where you guys get the pain and the swelling, and then it clicks and it opens up weird and you can't open it enough. So there's a lot of symptoms of TMJ. So as physicians and as chiropractors, we examine the TMJ and we can figure out what side is opening or closing too late, or what side that you have that disc displacement in. So that's kind of the explanation of TMJ. Pretty easy. You also have some muscles involved, which we're going to talk about now. So some home care. You can take your hands, just your fingertips, and so you have a muscle here. So close your mouth and then bite down, and you'll feel this temporalis muscle protrude. So you can rub that for about 15 seconds clockwise, and then rub it counterclockwise for 15 seconds just to get that muscle to relax a little bit. And then another exterior muscle is the masseter muscle, okay? Same thing, close your mouth and then clench or bite down, and you'll feel it pop up right here on your cheeks. And you can rub that one clockwise and counterclockwise also. And then one of my favorite things, I can find my pen here, is the pin trick, okay? So you're gonna take a pin and you're gonna hold it between your teeth, just like that, all right? So make sure your teeth, all right, I should have ate a bunch of Oreos and really gross you guys out today, but I'm gonna just use my fingers for a second. So make sure that if you have an underbite or an overbite, that you correct it by bringing that lower jaw forward, okay? So it's here. And then it's best to do this exercise in a mirror so you can see if you have any left or right deviation. So you have to correct it this way and this way so it bites down perfectly, okay? Just like that. And then whenever you bite down, I don't want you to clench. I just want to barely hold it between your teeth. What that does is it opens up this joint and it kind of tries to reset that disc. Remember, that disc is stuck forward and you're biting down on the ligament, so it kind of helps to maybe get that thing shoved back where it should be, okay? Now there's a lot of other exercises. Obviously chiropractic adjustments are pretty important, soft tissue work, ultrasound, a lot of other home care, and a lot of other ones that are specific just for certain people. But those are some general ones that everybody can do to help this condition. Hopefully, you guys got some out of this video. Again, we love putting out this content, especially about conditions that people normally don't think chiropractors treat. And TMJ dysfunction is one of them. So pass this on if you know someone that has TMJ issues or TMJ problems or pain or clicking or can't open. and hopefully they can benefit. As always, if you have any questions, you can call or come in for a free consult. So please like this video, share it if you want to, and I appreciate you taking the time out of your day to watch it. Thank you much.